On October 10, 2012, the Health Council of Canada held its annual symposium, Advancing Integrated Healthcare in Canada, Practices That Work. The chair of the National Symposium on Integrated Care and the vice chair of the Health Council of Canada, Murray Ramsden, set the course for a day of learning and exchange with 70 Canadian presenters on integrated care.
When I look out at the group here, I know that we have close to 500 participants today, and as we know that buses are still coming in and people are still driving in from various areas close to Southern Ontario coming into this. And so I'm really excited about our turnout today, and particularly when I look out and I know that we're covering the full spectrum of individuals involved in healthcare. We've got policymakers, healthcare planners here today. We've got healthcare administrators and providers, researchers, educators, patients, and representatives from those organizations, patient organizations. So I also appreciate that this is somewhat a shorter work week for many of us, with having Monday being the holiday and now Wednesday. It's taken out. I appreciate that you've given up a lot of your time to be able to be with us today, and I want to particularly thank you for that. Also, I want to acknowledge those that have come in from out of town for this symposium, and particularly last night I had the pleasure of meeting Dr. Dennis Codner, who's sitting in the front row here, and who'll be speaking to us from some of his experiences in the United Kingdom on this topic, and you're going to be hearing from him shortly. And also to welcome the Honourable Fred Horn, Minister for Health for the province of Alberta. Thank you again for coming today. I'd also like to take this opportunity to thank our advisory panel who helped us plan the symposium, and this includes Ross Baker, Brad Campbell, Nimbit Karam, Linda Olenek, Joan Park, Sam Short, and Michael Villeneuve. I know that those of you that are in the policy planning area probably are very familiar with work of the Health Council of Canada, but some of you that are providers may not be as familiar with the work of the Health Council, so I thought I'd just take a moment to give you just a brief background on the work that the Health Council of Canada does. And as some of you probably know, it was formed a little over 8 years ago as an independent national agency to report on the progress of healthcare renewal across the country. And we continue to do that work on a regular basis. But more and more, the focus, the energy is being shifted to identifying best practices and innovations that will contribute to a better health outcome for all Canadians, and sharing those practices with policymakers, providers, and the public. So today's symposium, which is Canada's first symposium to focus on integrated healthcare, will be highlighting some of these innovative approaches that are taking place across the country. And we also hope that today will provide an opportunity for all of us really to engage in the conversation on the future of integrated healthcare in Canada. So why a symposium on integrated care? And I think a lot of us know that we've been around this topic for quite some time. And I can personally remember, the federal dollars got put into this program in the past, and we've had provincial dollars put in, and we've had some programs that have gotten up, some have started, some have sputtered. But I think, when you stand back, you realize more and more that the conversation, there is more momentum coming towards this topic now. And I think it's there because we're all struggling to contain healthcare costs while attempting to meet Canadians' expectations for a healthcare system that will provide us all with high-quality care where and when we need it. And we're all struggling with the questions. How do we address gaps in care, eliminate duplication, improve continuity and quality of care for patients? In short, how do we deliver care that is more efficient and cost-effective and improve on the patient experience and health outcomes at the same time? And this is where I believe that integrated care has a really significant role that can play in this whole continuum. So when we talk about this, what do we actually mean by the term integrated care? One is it's patient-centered. It's focused on the continuity of care. It involves coordinating care between organization, services, and providers. And it operates at all levels, from a systems overview right down to the front line. Now here in Canada, as I've talked about earlier, my belief, and I think most of your belief out there, is that integrated healthcare systems are happening, but happening slowly. Countries like the United Kingdom are much further ahead. At least that's what I'm assuming we're going to be hearing, that they're much further ahead, and maybe they aren't. And this morning's plenary and panel discussions will look at some of these issues that are preventing us from really implementing integrated care and considering some of the possible solutions. For example, how do we move from creating linkages and coordination to real integration? How do we make that shift from informal approaches to more formal structures? And on a positive note, there is widespread support for integrated care. There are many new strategies and initiatives that are emerging across this country and across the continuum of care, from health promotion and prevention through to rehabilitation and palliative care. And then we at the Health Council continue to hear from our stakeholders that accessing information on these strategies is difficult. And it's particularly how to implement and evaluate integrated care. So we hope this event is going to help to address that. So our purpose today is to showcase Canadian examples of applied innovative practices. We'll be highlighting what is working and where early results show promise. And you'll hear how initiatives have been designed, implemented, and evaluated. And you'll hear insights from the perspective of people that use health services and those who plan and provide them. Our concurrent sessions look at integration within and across sectors, from primary care through to home care. We will look at specific population, children, seniors, patients with chronic diseases, and Aboriginal people. We will look at initiatives involving interprofessional teams and the use of information technology to support integration. In organizing this event, we were very fortunate to have over 170 abstracts that came in. And unfortunately, we can't profile them all. We've selected 38 to present today and to represent as much variety and as many areas of the country as possible. And you're going to be picking up on that in the concurrent sessions. We've designed our program with a strong emphasis on applied knowledge, and we hope that each of you are going to leave this symposium with concrete ideas and insights that you can adapt and apply when you go back to your setting. And we also hope to be able to further stimulate further conversation about how we can work together to create a more integrated healthcare system in Canada.
Visit healthcouncilcanada.ca/symposium to watch more videos from the Health Council's National Symposium on Integrated Care.